From vaccinations, germ theory, antibiotics and life-saving surgeries, to blood transfusions and medications to help physical and mental illnesses, the progress of science has undoubtedly saved and elevated countless lives over the years. This has resulted in a society where entire illnesses have been eradicated, infected wounds are no longer a death sentence, and psychological distress is treated rather than shamed. However, whilst there are rigorous health, safety and ethical assessments that go into studying modern science, these have been put into place because the road scientists and psychologists have trodden over the centuries has not always been transparent or consensual, and sometimes it has been completely inhumane. In 1918, during the influenza pandemic, which killed an estimated 20 to 50 million people, an experiment was performed on a population of prisoners. The age group most affected by this disease was young adults, and just as there was with the COVID-19 pandemic, there was a rush to learn as much as possible about the disease, including how the virus was spread. In an attempt to do this, 3 doctors from Boston offered prisoners at the military prison on Deer Island in Boston Harbor a risky deal. If they were willing to participate in an experiment that would see them deliberately infected with the flu and survived, they would be pardoned and released from their sentences. 62 volunteers were selected to participate in the trials, but whether they truly knew the risks involved or were just so desperate for a pardon that they believed the risk to be worthwhile is unclear. The experiments would see some of the prisoners injected with infected lung tissue from sick or diseased patients, have infected tissue dropped into their eyes, and sprayed into the nose and mouth with infectious aerosols. Others would see mucus taken from critically ill patients and put into the noses and throats of prisoners. In other parts of the trials, experimenters would take the blood of the sick and inject it into the healthy, to see if it was spread through infectious microorganisms in the blood. Despite all this, not a single patient in the experiment died of the disease. They didn't even become ill. The likely explanation is that the prisoners had already been exposed to the disease some weeks earlier, gaining natural immunity to it prior to the experiment. Having already survived it once, they had now essentially been offered a free pardon, albeit with a strange few weeks of eating mucus from the deceased. In 1920, American psychologists John B. Watson and Rosalie Rayner aimed to show that fear is a learned response that could be instilled into an infant through classical conditioning. For the experiment, the two took a healthy, and in their words, stolid and unemotional infant, and began experimenting on him from the age of about 9 months. First, they attempted to gauge how fearful he was of various objects, including a white rat, a rabbit, a dog, a monkey, with masks on, cotton wool, and burning newspapers. The team noted that the child, named as Albert B in the paper, showed no fear at all when responding to these objects. That would soon change, directly thanks to their intervention. The team presented Albert with a series of fluffy animals before striking a steel bar with a metal hammer near Albert's head. This of course caused distress to the infant immediately, and the team was able to demonstrate that little Albert began to associate the fluffy objects with the distressing noise, and developed a fear response to them as the instant the fluffy rat was shown, the baby began to cry. Albert continued to respond normally to non-fluffy objects, but would be fearful of anything fluffy, including rabbits, dogs, cotton wool, fur coats and a Santa Claus mask. During the Santa portion of the experiment, he showed withdrawal, then slapped at the mask without touching it. When his hand was forced to touch it, he whimpered and cried. Eventually, he cried at the mere visual stimulus of the mask. These cruel experiments may have caused long-term psychological damage to the child. In 1932, the US Public Health Service and the Tuskegee Institute began an unethical experiment on 600 black men without their informed consent. The study began with 399 men with syphilis and 201 without. The goal was to observe the natural history of untreated syphilis in African Americans, essentially by tracking the men over the course of many years, ensuring that they didn't receive treatment for their disease. The volunteers were told that they were being treated for bad blood, and that treatment would be paid for by the US government. What they actually needed treatment for was syphilis, but the experimenters did not inform them that they had the disease. Instead, they were given placebos and treatment that was known to be ineffective. As an extra incentive, they were offered free meals and, grimly, free burial insurance. The experiment took a turn for the worse in 1947, when penicillin had become the standard treatment for syphilis, and the experiment continued on regardless. Over the years, the men began to experience the later tertiary phase of syphilis, and the scientists watched as they slowly began to go blind, suffer from organ failure, develop dementia and paralysis, and eventually died. In order to conduct autopsies on their subjects, they began to pay the funeral expenses. The study went on until 1972, when a whistleblower leaked information on the study to the New York Times. When the story came out, people were outraged, and the study was ended shortly afterwards. By the time it ended, 128 patients had died of syphilis or its complications. 40 of the men's wives had been infected with the disease, and 19 of their children had congenital syphilis passed on to them. In 1997, President Bill Clinton offered this apology on behalf of the United States to participants in the study, saying, "What was done cannot be undone. But we can end the silence. We can stop turning our heads away. We can look at you in the eye and finally say, on behalf of the American people, what the United States government did was shameful, and I am sorry." This experiment takes the double title of being ethically dubious and scientifically pre-invalid. Philip Zimbardo's Stanford prison experiment has been the inspiration for fiction for years, due to the extraordinary events that took place as the experiment became out of control. The experiment took 24 volunteers and placed them in a mock prison in the basement of Stanford University. The participants, who had been psychologically evaluated to eliminate candidates with psychological problems or a history of violence or drug abuse, were then assigned to be either guards or prisoners. The prisoners were treated like prisoners, stripped of their possessions by the guards, referred to only by their prisoner number, and kept in cells for much of the day. Guards were told to do whatever they deemed necessary to maintain law and order within the prison. Over the course of the experiment, both groups appeared to begin to conform to their new roles a little too well. Guards began to harass and mistreat prisoners. Prisoners began to act crazy, in the words of Zimbardo. By day 2, the volunteers playing the role of guards had begun psychologically torturing their prisoners. They were stripped naked, hooded, chained, and denied food and sleep. The prisoners became traumatized with half-suffering nervous breakdowns, so that by day 6, the experiment, planned to last 2 weeks, was called off. For a time, the main concern people had for the Zimbardo experiments was for the participants, or that the findings of such a small study could be applied to humanity. But more recently, audio recordings have emerged that suggest the whole experiment was invalid, and that a lot of the actions of the participants were done at the explicit or implied instructions of the experimenters. Overall, research involving human subjects is littered with a history of scandal that often shapes people's views of the ethics of research. Often the earliest cited case is English physician Edward Jenner's development of the smallpox vaccine in 1796, where he injected an 8-year-old child with pus taken from a cowpox infection, and then deliberately exposed him to an infected carrier of smallpox. Although Jenner's experiment was fortunately successful, the method of exposing a child to a deadly disease in this way would undoubtedly nowadays be seen as unacceptable. Perhaps the most notorious cases of unethical research were revealed during the Nuremberg trials concerning Nazi experiments on concentration camp prisoners. This research included involuntary sterilization, inducing hypothermia, and exposing their subjects to diseases such as tuberculosis. Yet, despite the litany of failures to maintain ethical standards in research, these remain the exception, and a focus on scandals can seriously distort proper discussion about research ethics. Ultimately, there is no universally accepted position as to how such research should proceed. Laws and codes are far too general for deciding such cases, which is where ethical judgments, committees, and arguments come in that allow agreement to be reached. These can delay research or draw on resources available for a trial, but they are essential if we are to maintain a high level of scrutiny in often complex situations and prevent further scandalous cases from arising.